Brothers and sisters, good morning. In October each year, we observe Health Month, and it's customary for us to have a professional and expert speak to us on a matter of preserving our good health. So this morning, it's my pleasure to introduce to you Dr. Mike Mills, who is a graduate of the postdoctoral internal medicine program at the University of the West Indies. Mike completed his subspecialty training in gastroenterology at the Royal Infirmary in Edinburgh, Scotland, and is now an associate lecturer in the Department of Medicine at the University of the West Indies, and is a consultant internist and gastroenterologist at the University Hospital of the West Indies. He is a member of the Association of West Indian Gastroenterologists, a fellow of the American College of Physicians, fellow of the American College of Gastroenterology, and a fellow of the Royal College of Physicians, Edinburgh. He is the current president of the Association of Consultant Physicians of Jamaica and governor of the American College of Gastroenterology for the West Indies chapter. So that's Mike's professional bio note. But Mike is also, on a personal note, married to a beautiful pediatrician and child cancer specialist, Michelle, and they're both parents of two lovely adolescent children. And even more importantly, Mike is a member of Church of the Ascension, where he's very actively involved in the ministry there. So, Mike, we welcome you, and we look forward to your presentation on colon cancer.
Okay, good morning, everyone. Good morning, St. Luke's family. Yes, my name is Mike Mills, and I'm not ashamed to say that I'm an orchid killer, okay? All right, so I'd like to thank the St. Luke's congregation for inviting me to come and speak to you this morning. I was just checking the Ascension feed, and I think we'll still finish before Ascension today, so not to worry. We're going to look at colon cancer this morning, but before I begin, I'd like to apologize to the IT team, Sister Donna and Carlette and Mr. Reed. As at Ascension, I'm normally the one dealing with IT, and it's very tricky sometimes to get things to be coordinated. And this morning, I think I gave them a little bit of trouble in trying to set up our IT, so I apologize in advance for any glitches which may occur. I'd also like to encourage you to make it as interactive as possible. You can ask questions if there's anything that you'd like to have clarified. So we're going to be looking at colorectal cancer screening. It's a relatively more and more well-recognized area. And okay, here we go. And I'm sure in the last year, most of you would have been familiar with the gentleman who is now projected on the screen. This is, of course, the actor Chadwick Boseman, who played the role of Black Panther in one of the more popular movies last year. And he passed away earlier with a diagnosis of colorectal cancer at a very young age. And this was an unexpected diagnosis because of his age, of course. We usually associate it with a much older age group. But you can see here that it does affect a relatively young healthy male. But of course, it's not confined to the international audience. We do have local individuals who you may recognize been affected by and passed away from colorectal cancer. This is one of our entertainers, Feluke, who was in the newspaper a lot when his struggles with colorectal cancer and passed away last year as well. Everybody recognizes 1,000 volts of John Holt, who also passed away from colorectal cancer. And then we have one of the leaders in our political sphere, Dr. Peter Phillips, who was diagnosed with colorectal cancer, a public figure. And then most recently in the news, you would have heard about our songbird Karen Smith, who passed away from colorectal cancer. So, not to say that it is an overwhelmingly common diagnosis, but it is something that is becoming more and more in our local thinking. So colorectal cancer, everyone has a colon. It's that large intestine, it's the last part of the digestive system. And just like any part of the body that is growing, cancer can affect that aspect of the body. So we're just going to look at some of the things which has to deal with colorectal cancer and some of the steps you can take to reduce the likelihood of either being diagnosed with colorectal cancer or having a bad outcome if the diagnosis does occur. So it's a third leading related cause of cancer-related mortality in Jamaica. It affects both males and females. So for males, the number one cause of cancer-related death would be prostate, followed by lung. For females, breast, followed by cervix, but colon follows as a third most common cause of cancer-related death. And according to the Jamaica Cancer Registry, they've noted that we have a rising incidence of colorectal cancer locally, anywhere from 13 to 18 cases per 100,000 diagnosed annually. Now, like cervical cancer, colon cancer can be prevented by taking steps. So this is where cervical cancer and colon cancer become a little different compared to some of the other cancers that we know about. In terms of colon cancer, the key thing is to perform some type of screening test to detect a precancerous stage, which is known as a polyp, which can be removed to prevent the progression to colorectal cancer. So this is the objective of screening. Now, the risk factors for colorectal cancer are important to note. So it does affect males and females equally. Age is an important non-modifiable risk factor. So as you get older, it increases the risk of colorectal cancer. And we recognize that this happens more frequently above the age of 60. A diet which is very high in fat and very low in fiber increases the risk for colorectal cancer as well. There are some other modifiable risk factors like smoking, any type of smoking at all, alcohol use in excess, having a family history or personal history of colorectal cancer, or colon polyps increases the risk. And then there's a condition known as ulcerative colitis, which is an inflammatory condition, not very common, but does increase the risk for colorectal cancer. So how do you recognize if you indeed do have colorectal cancer? Now, the key thing about colorectal cancer screening is that you're not going to wait for any signs and symptoms before you actually start to think about it and take steps to reduce your risk. But of course, if you want to know if it is present, you will need to recognize what these signs and symptoms are. So usually, the signs and symptoms only occur when the disease is very advanced. Change in bowel habits, that's the first sign or symptom that we tend to associate with colorectal cancer. So you can have either diarrhea or constipation. Usually constipation more commonly than diarrhea, and this constipation is very specific to an individual. So it's a change in your own bowel habit, which means you need to be familiar with how often you normally pass stool. Some people it's once a day, some people every other day, twice a day. But once there's a change, which is not explained by something in your diet or environment, and this may be an indicator that something as serious as colon cancer could be responsible. Of course, there are many other causes of a change, not confined to colorectal cancer. Blood in the stool, another hard sign But of course, there are more common things apart from colorectal cancer, like hemorrhoids, for example, which can cause bleeding. But the important thing is that you need to know what the cause of the bleeding is so that you're not assuming it's as a result of something that's more benign and forgetting to check. And especially as you get older, we tend not to ignore some of the more serious causes. Mucus in the stool can be normal, but of course, if it occurs suddenly and is associated with bleeding, then this is something that needs to be diagnosed. Loss of appetite, weight loss, which is unintentional. These are signs of advanced colorectal cancer. Unexplained anemia or low blood count. This is associated with, again, a significant colon cancer which has been growing for some time. And usually, if you're over the age of 50 and have a low blood count, then that's one of the things that we tend to think about looking for. So what are some of the tests that are available to try and diagnose colorectal cancer? Here's an image of a barium enema. So this is one of the earlier tests. It's a special type of X-ray. When you go to the X-ray facility, they will put some barium, which is like a dye, inside the colon, take some pictures, ask you to turn on a table to see if there's anything which is growing inside the colon, which may be an indicator of either polyps, which are at the early stage, or colorectal cancer itself. So, apologies if you can't see it from the back, but there is a small little circular impression here. So this is a normal looking colon. So these are the walls of the colon, and then this white thing is the barium to help you to outline the bowel. And then the radiologist will look for these little things which are not supposed to be there. And then in this case, this is a small polyp which we can go in and remove. Now the barium is not exactly very good at telling us details about what is there. So other tests have been developed to try and find out if we can identify colorectal cancer in the early stages. Here's a barium enema showing this narrow area between these wide white areas. So the wide areas are normal, and the narrow area suggests that the barium, which is like a liquid, can't pass through something here. So it's just trickling through, and it's trickling through because there's a cancer sitting in the bowel wall around here. So this is something that we'll see on a barium to indicate that something like a cancer is inside the bowel. This is a different type of test called a CT colonography or CAT scan of the colon. And here you're seeing more detail. It's like the barium, but it's run through a computer, and the images are now a little clearer. So here you're seeing a larger polyp sitting on the wall of the colon, and here you're seeing something else, diverticular disease, which is completely unrelated. But as you can see, the tests become more sophisticated to try and identify early what is happening inside. There are other tests, of course, and the point is that you need to have some kind of screening done to identify the presence of either an early cancer or a polyp, which is a precancerous condition. So screening occurs in everyone who is over the age of, we say, 50. Some individuals may start to do screening earlier, so at age 45. And this is whether or not you have any signs or symptoms associated with what you think may be bowel cancer. So just as how you do your pap smear and mammogram and prostate checks at an appropriate age, when you reach the age of 45 to 50, then you need to do screening. If your relative has had cancer of the colon, then you need to start your screening earlier. Depends on what age they were diagnosed. So if they're diagnosed at an age which is 10 years before age of 50, it means that your risk is a little higher at a younger age, and you need to start your screening a little earlier. Now, these tests are done on outpatient, so you don't need to be admitted to hospital to do them, but it's important to access one of these tests. Now, it's common locally. I'm looking for another slide which seems to be missing. Let me just make sure. This is where the glitches in technology come in. Let me just see here. Oh, sorry. Oh, here we go. Let's just jump here. And if we can hope to start this video. I'm sorry, how does this go? All right, so as luck would have it, here's one of the things which All right, so while we wait on that, so the image that's displayed is actually a video, and there are 4 of them. This is one displaying a normal colon. So I know it was missing because there are 2 other tests available for screening, which are inserted here. So you have your barium enema, CT scan of the colon, and then this test, which is a colonoscopy, and then another test looking for blood in the stool. So I'm going to tell you about the colonoscopy, and I'm going to tell you about the blood in the stool, because those are the 2 important tests that you need to be familiar with. So the first one, and by the way, sorry, it's playing. All right, so here's the thing now. So the video is playing online because the online stream is coming straight from my laptop, whereas the hard drive is taking a while to load. So if you want to watch the video, you're gonna go, now here's a time when in church, sorry Reverend Riley, take out your phones and go to the YouTube link or what, Facebook or Instagram for St. Luke's and look at the video. And you could even do it right now, even though it's delayed by about 20 seconds depending on the latency of the stream. But in essence, what it's showing in the first video is that this is a normal colon. And if you look at the lining of the normal colon, you're not going to see anything on the surface, okay? So you've emptied the bowel, you came to the procedure room, we gave you medication to make you sleepy, passed a camera through the rectum into the colon, and looked around to see if we see any polyps sitting on the surface. Now, the next video after this one, which is non-existent on this slide, shows you a tiny polyp. Tiny polyp is like a little warty growth that we spoke about, which is a precursor of cancer. So that's the second video that you're going to look at, which is showing you a small little thing sitting on the wall of the colon that we can go in and take out to prevent it from getting larger and potentially becoming cancerous. Now, the third video shows you a little bigger polyp, which represents the fact that polyps will grow over time in size and ultimately may become cancerous. Not all polyps do, some can, but we have to take all of them out to prevent that. The final video shows you the actual cancer inside the colon. And the thing about it is that you want to recognize that the larger the cancer gets, is the more obvious it becomes to you before doing any tests. Now, by the time it shows up in the blood or in the stool as blood or changing your bowel habit, it means that the cancer is already there. So the key thing is to try and find the little polyps beforehand, take them out before you can get a chance to get so large. Okay? Now, that's the colonoscopy. Now, that test is done at age 45 to 50, and then every 10 years if we don't see anything. The other test after that is a simple test where you check for blood in the stool, but not blood that you see obviously. This is microscopic blood. So If you're used to doing executive annually, then they will send your stool to the lab to check for blood. And this is a form of screening for colorectal cancer. Now bear in mind, if it does show blood in the stool, it means that you have to find the cause. So it only prompts you to look for the cause of which cancer could be the cause. Okay, so that's where that test comes in. Now it's not end of the test, because if it shows blood, we need to do another test to look for the cause of the blood. But by doing that test, it makes you keep a check on your colon, okay? You would miss something that's very tiny, but it's better than doing no test. Okay. So I'm not sure if, oh, okay, awesome, or not. Okay, so this was the final video which showed the actual cancer itself, which basically is blocking up the bowel. So if you remember the first one, there was a nice passageway for stool, and this one does not have a passageway. So there's just a small opening for stool, and normally it should be this whole thing, which is free for stool. So you get constipation because the stool can't pass through there, and then it's going to bruise these little surfaces and show up as blood and stuff. And we can sample this and send to the lab to confirm that it is indeed a tumor. Okay, oh, super fast. All right, if we can just slip back 3, since I'm out of the slideshow, 3 slides, please. If you can just go back. All right, this one. Okay, awesome. So first thing is that prevention is key for colorectal cancer. Okay, so you have to do screening. So as I said, just like when you do your mammogram and your pap smear and your prostate checks, you need to think about doing screening for colon cancer between 45 and 50. And then there are a few things to pay attention to. Right, thanks. So diet is important. So having a diet that's very high in fiber, low in fat, low in red meat, low in processed foods. Alcohol to be limited. It doesn't have to be completely eliminated, but the standard recommendation is 1 or less drinks for women, 2 or less drinks for men per day. Family history. So you need to know your family history. So you need to know mother, father, grandparents, aunt, what is their risk for cancer. So it informs you of your risk. And then doing any of the screening tests which we discussed, as that will help you to find the polyp if it's present in the early stage, so you can remove it before it progresses to cancer. And even if a cancer is present at the time, then we can ideally find it early, do some kind of intervention to have the best outcome as possible. So that's the end of the formal presentation. Thank you very much for your attention, for allowing me to, hopefully try and impart some information to improve the health of the St. Luke's population. And wish you all a very good day. And again, thank you very much for inviting me. If there are any questions, please feel free. I think we have a few minutes, if so.
So we can take 2 or 3 questions.
I forgot there are people upstairs. Good morning, people upstairs. Sorry you couldn't see, or could you see? You have a monitor up there? They don't let you see anything up there?
I'm going to watch it.
You can see the screens?
May I ask a question, please?
Yes, you can ask a question.
Is there any intentional effort to identify carcinogenic materials in the foods we eat, the cosmetics we use, the toothpaste, mineral supplements, medications that could have impacted our potential for cancer of colon or any cancer at all?
Okay. I might have lost some of it, but you're asking if there's any
Research.
cosmetic material or foreign agents or anything that we encounter in our environment which
that are being used in food, medicine,
additives and
cosmetics
supplements
and
and
toothpaste and mouthwash and so on that would impact our potential for cancer,
right.
whether
Okay, so
colorectal or whatever.
so theoretically, anything that you put into your digestive system is going to end up going down into the colon or large bowel and potentially interfering with the way that it works down there, because there is a balance inside. So you have a working immune system that's inside the intestine, and the immune system helps to clean up any cells that are likely to be cancer forming. Okay, so once the cell looks like it's going to start forming cancer, if your immune system is healthy, then it's supposed to attack that cell and prevent it from setting in and making problems. Now, taking external things like chemicals and anything that is not a natural food substance, theoretically will increase the risk. Now, the ones you mentioned, like the toothpaste and cosmetics and things like that, when they are approved for use by the different regulatory agencies, they're screened to see if they have any of the known cancer-causing agents. Now, they would not be listed for safe use for human consumption if they contained any of them. So as far as we know, and if you trust the science, you have to trust the science. If it's from a recognized source and you can list the ingredients and it's on the shelf, then it would not contain anything that's been shown to cause cancer. Now, it doesn't mean that it can't become contaminated by something. That's possible. And we've seen cases where things have been recalled because they've been found to contain something. But by and large, the risk comes in cases where you're either using things which have not been studied and you're not sure what the ingredients are, or there is a contaminant. So the things that we recognize would be like the processed meat, for example, in terms of colon cancer. There's a lot of debate about the risks for prostate cancer and ACEs, for example, in our males, but there's not enough information or data to support one way or the other, okay?
Thank you.
So you can still trust that the things that are in the well-recognized chemical containing substances that you have to ingest, that they are safe. Now, this is safe at a certain dose. If you go and overdose on something, then that's different, okay?
Thank you.
Question? Okay, so the question is, we recognize that those with a family history of colon cancer are encouraged to screen at an earlier age. Should they do it more frequently? So standard average risk individuals would by and large be most people, which means age 45 to 50. That's when you start, because it takes about 10 years to go from polyp to cancer. So if you do it too often, you're not going to benefit anyone by looking too often, which is why we say look every 10 years if you're average risk. If you're high risk, meaning your father had colon cancer at age 50, you don't start at age 50. You start 10 years before, so you start looking at age 40. If we didn't see anything at age 40, we'd still say 10 years at age 50. We wouldn't bring it up. The only time we make it shorter, so we say come back in 3 years or 1 year or 5 years, is if we saw something at the first time. So if we saw a polyp, depending on the number of polyps, the size of the polyp, the type of polyp, we say, okay, come back in 3 years because your risk is higher. But average, we say, okay, you start at appropriate age once, and you do 10 years if you don't see anything, and then 10 years after that, until you hit maybe about 75, 80, and then we say, okay, maybe we can stop now.
Okay, are there any other questions? So, Mike, can you share with us where you know, a screening test like a colonoscopy is available in
Yes.
Kingston and generally throughout Jamaica? And can a patient request that of their physician, or can a patient go directly for a colonoscopy?
Okay, so the two screening tests that we'd recommend would be the fecal occult blood test and the colonoscopy. Fecal occult blood test is the one where you take your stool sample to the lab and we look to see if there's any trace of blood there, and you have to do it every year, 3 times through the year. Every year, 3 samples for the year you send to the lab and they check for blood. If you do the stool test for blood only, then that's sufficient, because once you find something, it's still protective. Now, if you're going to do the colonoscopy as your screening test of choice, then it's available either by referral from your doctor. So it has to be done by someone who is qualified to do it. That's important as well. So it can be accessed in the private system, it can be accessed through the public system, even though there's going to be a long wait because of the public system. It can be accessed if you do not have a doctor. It can be that you request it, just like how you would request a mammogram or a pap smear from the appropriate physician. So there are a number of avenues to access the procedure. There is a limitation in terms of having safe, reliable specialist care, no doubt about that, but it is not impossible. And as I said, the key thing is to do at least a screening test. So if the colonoscopy is not accessible for whatever reason, cost or availability at the time, and you choose to do fecal occult blood testing, which is more affordable, any lab will do it, then that is something that you should make sure you do, okay? So the key thing is to do any of the screening tests at the appropriate time and to continue with the schedule.
Thank you. So on behalf of our congregation and attendees and guests this morning, I'd like to thank Dr. Mills for coming to worship with us and also for coming to enlighten us on the importance of screening for colorectal cancer. We hope that what we heard we will digest and we'll act on it, and also incorporate the screening practices that Dr. Mills has recommended to us in our regimen to maintain and preserve our good health. Our best wishes to you and your family, Dr. Mills, and have a wonderful weekend. Thank you.